Hey everyone, I am waiting for my son to finish basketball practice and I just happen to have my chalkboard, so I wanted to talk about chest pain. He didn't want to go to practice today because he was having chest pain last night. In a regular family, you would wonder, chest pain, is it the heart? I think that most of my patients will worry about heart as being number one. I wanted to discuss my problem solving, how I use my experience to figure out what to do best. So let's break it down into four things. When I think about chest pain, essentially just think about the chest itself. Anatomically, even if you don't understand the way the body is made up of, you know you've got the chest wall. That's essentially muscle, bone, cartilage, and the lining of the lung. Then you have the lungs itself and the tubes that feed the lung oxygen. Then you have your heart, and then you have your stomach. And those are the four big things that can be involved in chest pain. Somebody might be asking, well, the stomach is down in the belly. Why would that be involved in chest pain? And without getting into all the details, it's because of where the nerves that take care of the chest originate from. The nerves that take care of the chest pain also take care of the stomach because of the way we're brought up, because of the way humans evolve. So sometimes when you have a stomach problem, it can manifest as chest pain or even shoulder pain. Now, in trying to figure out chest pain depending on the patient, I always divide it into age. If I have somebody like my son who's in his teens, the likelihood of heart disease is low. Likelihood of sudden death is low, so we can take our time and figure out the most practical approach for symptom of chest pain. When imminent danger is not the worry, I'll go with more practical reasons. And the number one reason for most people who have chest pain is going to be stomach. So in a young person, I focus in on the possibilities of stomach being the reason for chest pain. Second possibility for a young person is going to be the lungs. Again, you can figure out the anatomy from the illustration. And it doesn't have to be associated with a cough or shortness of breath. It can actually just be lung tissue that's causing the pain. Third thing, for a young person, I'd think chest wall. Because of the activity level of a young person being so high, I would consider chest wall as being number three. The fourth is going to be the heart. Usually by the time you hit teenage years, it most likely would have been found by your doctor because of all those visits we have when a child is starting to grow. Now, once you have the four things established, then you can get into more details about the associated symptoms. If you have chest pain at night after eating a hot, spicy meal or drinking pop, then the likelihood is it's going to be from reflux. That's a stomach issue. Acid, especially when you lie back, seems to go into the esophagus and cause chest pain by itself, or it can also be associated with vomiting, nausea. Sometimes sitting up or taking a Tums or a Pepsid will relieve the symptoms. The old-fashioned way was to do a glass of milk at night, but I don't think that helps much. In fact, there are problems with taking too much antacid in the form of calcium or magnesium and then taking care of the symptoms temporarily but having it flare up again once the milk or the Tums is out of your system. In the long run, it just means changing around your food practices, strengthening up this thing called the lower esophageal sphincter with medicines like Pepsid, Zantac, Tagamet, or even melatonin at night, and sometimes taking care of stress or the stress response. In the case where you have chest pain associated with activity or coughing, then I think that most people would shoot for the lungs as being the source. Usually if you have somebody that suffers from bronchitis or bronchospasm, asthma, reactive airway disease, exercise-induced asthma, those would be easy giveaways. And for that, you try an inhaler, see if the symptoms go away. In the form of chest wall pain, very rarely does chest wall pain happen without trauma. So always think about, what was gym class like the night before? What are we doing as far as exercise? Were we doing a lot of chores at home? Or was there any contact or contact sports? Those are usually a giveaway of the reasons for chest pain. Firefighters. If it's severe, I'd worry about rib fracture, punctured lung, or skin infection. Sometimes zoster can present that way, or shingles. That would lead to more questions than answers, or at least a visual investigation of the skin or a feel of the muscles and bones. The final thing is going to be the heart. And again, as a young person ages and is very active, the likelihood of having a heart problem is very low. There are things called mitral valve prolapse, sometimes red herrings for heart problems being the cause of chest pain, but an astute physician should be able to pick that up on exam. The important thing is most of these problems are not risk factors for sudden death. so we can take our time and work them up. On the flip side, when we are dealing with chest pain in an older individual, say 40 years of age or above, then the possibility of sudden death or imminent danger is high. At that point in time, the clinician is supposed to worry about the worst case scenario and work our way down for the diagnosis. And the worst case scenario is always sudden death or heart attack. Doesn't matter if you're obese, you smoke, you have high cholesterol, you have high blood pressure. It doesn't matter about that. You can have no symptoms at all, and 50% of the time, the first symptom of a heart attack is death. So you really have to be careful about just blowing things off as far as symptoms, or interpreting whether these are warning signs. So my usual workup for anybody 40 years or above is going to be worry about the heart first, and again, questions and answers will be important. An EKG gives you a snapshot in time, but it's not the best test. An exercise stress thallium or exercise stress echo test would be the best. But that's a couple $1,000s, and we can't do that on everybody. It still takes questions and answers and ruling out disease properly. Going to an emergency room is always a wise thing, but if you don't have insurance or have a high deductible, you're going to be paying a couple $1,000 just for them to tell you you're okay at this point in time. Follow up with your doctor. So I think having good communication skills with your doctor and always getting a checkup once a year would be important. If there are high risk factors, get the workup out of the way, or at least call your doctor. The second thing I'd consider for my older patient with chest pain would be the stomach. Again, the stomach can cause pain even if it's down in the abdomen. Because of the way the stomach shares its nerves with everything else in the chest cavity, it can throw pain into the area where the heart is. It can throw it to the left shoulder. It can sometimes throw it to the right shoulder or straight to the back. But you always have to rule out the heart as being the issue. There is one dangerous thing if you have ulcers or a bleeding ulcer, which most of the time you'd figure out with your doctor visits. That can be the cause of the chest pain, but the likelihood of bleeding out from acute exacerbation of a bleeding ulcer is very low. I really think that the symptoms will determine themselves over the course of time. It's just a matter of you listening to the symptoms and reporting them or getting help. The lungs are also a reason for chest pain, and that would be number 3 on my workup. Believe it or not, lung cancer is a higher cause of death than breast cancer, and you don't have to have a smoking history to be high risk. So if you're coughing up, you're having difficulty with shortness of breath, and it's associated with your chest pain, then again, another reason to get to your doctor. A chest x-ray might be important, but if there is a high family history or you do smoke, then a CT scan of the chest would be the best test to be done. Finally, there's chest wall, muscle, rib, any kind of bone, or even skin. In some cases of chest wall pain, it can actually be zoster, also known as shingles, that causes the pain, but usually that kind of infection will blossom into the rash in a couple of days. Some of my patients get in because the pain is so intense. The giveaway is usually that you've been exposed to somebody with zoster or chickenpox prior, and another good reason to get the shingle shot in case you're high risk. If my patient is in their 60s or 70s and they have chest pain after a bout of coughing, you have to worry about a broken rib. Sometimes with osteoporosis, all you have to do is sneeze or cough or turn the wrong way and you can break bone, whether it's a rib in the front or a backbone radiating pain around to where the heart is. It can masquerade as chest pain as well. An x-ray and a good history will tell us about that. And there are obvious variables that make the decision-making process a little bit different with everybody. It can also be muscular from a pinched nerve in the back. I've had people that sleep the wrong way or lift up objects that are too heavy for them and actually sublux a rib, and this is the value of chiropractic. I'm a firm believer in chiropractic manipulation, and I have a chiropractor myself in South Elgin, and this is where seeing a chiropractor excels in the fixing of those subluxed ribs for the chest pain. The treatment depends on the diagnosis, and the diagnosis depends on the communication between you and your doctors. So it's always good to have a doctor that communicates properly with and is on the same page. Hopefully this helps. Don't forget to give me a thumbs up and subscribe to me for weekly words of wisdom.